Hi, my name is Evelyn Seconder, and I'm here to tell you about what an ileostomy is. I am going to spider monkey if you don't stop is something my husband used to tell my kids when they would pick at him. My husband had an ileostomy, and to make light of the situation, he used to say that. An ileostomy can change everything you do daily. My husband having an ileostomy has taught me what it is, why people get them, how to live with one, and the quality of life having one and what it's like to have one reversed. What is an ileostomy, one may ask? An ileostomy is a surgical opening into the ileum, the lower part of the small intestine, from the outside of the body. An ileostomy provides a new path for waste material, aka poop, to leave the body after part of the large intestine, the colon or rectum, has been removed. Through the abdominal wall opening, a stoma, the lower or small intestine, is stitched into place where a pouch, sometimes referred to as a bag, is placed. Why do people get an ileostomy? The most common reason for people to get an ileostomy is because of irritable bowel disease that cannot or does not respond to medical treatment. Other causes for getting an ileostomy include colon cancer or rectal cancer, familial polyposis, which is a hereditary condition where polyps form on the colon, intestinal birth defects, Hirschsprung's disease, or accident or injury, which is why my husband had to get his. My husband had a tractor-trailer accident which caused internal trauma to his transverse colon. His transverse colon had ruptured and died and was causing an infection, so they had to do an emergency surgery to remove his transverse and ascending colon, leaving him with an ileostomy. Living with an ileostomy can be challenging. The common challenges for having an ileostomy is leakage, skin problems, bleeding and obstruction, and peristomal hernias. It's very challenging when the ostomy or stoma is one that is sunk down below the skin. Fitting the wafer on the stoma to prevent leakage is very difficult. It can be very painful at the ostomy site or the skin right around the stoma if it is broken out like a diaper rash. Getting a wafer to stick to skin that is severely broken down is almost non-existent, so again, leakage is a problem. What kind of life can you possibly have with an ileostomy? That is the question I asked the doctors when my husband had to have one. People can live perfectly normal lives with an ileostomy, provided the ileostomy will cooperate and you don't develop a peristomal hernia. What is meant if it cooperates is provided the ileostomy does not leak, or the skin doesn't break down, or even the stoma is out far enough to get a good fit with the wafer. Leaking problems with an ileostomy will make a person not want to go out anywhere for fear of leaking and making a mess and being embarrassed. Leaking problems with an ileostomy will make a person not want to go out for fear of leaking and making a mess and being embarrassed. Most people can live perfectly normal lives doing everything they used to do before the ileostomy. They swim, drive, run, exercise, and even work. Having an ileostomy reversed can be a risky surgery. There are many complications to get an ileostomy reversed before and after the surgery. The main complications of the ostomy surgery are excessive or uncontrollable bleeding that can lead to severe blood loss or even death. The after-surgery complications can be, but not limited to, DVTs, which are deep vein thrombosis, chest infections, bowel obstructions, wound infections, hernias, and an anastomach leak. An anastomach leak is where the two parts of the colon or the ileostomy don't join together. The bowel obstructions and anastomach leak are the two least common but most severe complications of having an ileostomy reversed. These complications can lead to the ileostomy being reversed and possibly becoming a lifelong stoma. Fortunately, my husband had no complications whatsoever, and his ileostomy reversal was a success. I have learned through my husband having an ileostomy what one was, how to live with it, the quality of life with one, and even what it is like to have one reversed. An ileostomy is a life-changing surgery that can be very difficult to live with, not only for the ostomate, but the family and friends as well. And here is my audience. My husband, the prior ostomate, my lovely daughter,
Oh, goodness.
Sarah, and my slow but happy son, Jason. Nope. Get over here. Say hi.
Hi.
Thank you.